many people request information from us because we're a research center, and the questions that typically come up are, what should I do differently? Because things have been offered that are, quote, standard of care, and is there something else to be done? And I try and ask patients to think very carefully about what their goals are, but there are more than one thing, there's more than one way to do something. And it may be a standard of care treatment, but something else, like an experimental trial. So I think they should always be asking that question. Is there an alternative approach? What is that alternative approach? How do I get information about that? And who do I ask? And what does it mean if I make that choice? And it's almost always in the context of clinical trials. What next is available? What experimentally is being done? What's the most potentially optimistic new form of therapy? Patients always ask me, what should I do? Because there are many choices. And I try as best I can to frame it somewhat back to them. What risks are you willing to take, particularly about uncertainties, and how much effort they want to expend in trying to seek out new treatments. So for instance, if somebody is being treated in a remote community and they're interested in a clinical trial that's 500 miles away, that's going to mean dislodging themselves from their support group, their family. It's going to mean travel, which increases fatigue. And is that reasonable for something that isn't proven? So I at least have to let them understand that sometimes hope and expectations drive people to do things that may not be necessarily in their best interests, but at least to keep that in mind. But I do suggest to them that they strongly talk to their doctor and clinicians who are experts, and there are not too many in the country who have at their fingertips information about clinical trials that would be appropriate for their case, and to get a second opinion, and to ask as many questions as possible, and then to look at the internet and other patient support groups and get a dialogue going with other people, particularly other patients, and start to network in that way to get information as well.